Jennifer, the infection rate gets my attention. Governor Cuomo yesterday in New York showing stunning infection rates for Brooklyn and Queens to the east of Manhattan. Tell our audience the dynamics of the various infection rates right now.
Well, what we're seeing, first of all, is that we passed a terrible milestone of deaths, but as far as cases, they keep going up, and there's really no sign of sort of an average stopping. The infection is rolling on, and what we're seeing is places that before had got control of their curves, they're starting to come back. So this is happening in the States, it's happening in the UK, it's happening in Europe. Countries are losing control of the virus again after having got it under control. And this is what we predicted would happen, but it's quite sobering to watch it happen in real time.
Peter Hotez was with us yesterday from Baylor, and he emphasized as the season changes, we will go inside. What are your thoughts on how the seasonal change will be for this pandemic?
Well, of course, it's a new virus, so we don't know for sure, but it has to be said that almost every respiratory virus comes into its own in the wintertime. Not only are people indoors more, but there's something about the cold air that respiratory viruses thrive on. So yes, I'm not looking forward to the winter. And also there'll be circulating seasonal flu, sort of adding that perfect storm element. So we've got indoor people breathing indoor air, we've got the cold, which the virus likes, and we've got this co-circulating seasonal flu that could really throw a spanner into the works.
Jennifer, is COVID less deadly this time around, either because we have a better handle on how to minimize the risks in certain patients when they're in hospital, or because, the more vulnerable are staying home?
Well, it's a bit complicated. It's not really less deadly. It's just we perceive it to be less deadly because back in the day, in the spring, when it was really taking off, we were only testing people who were sick, and it appeared that 1% of people were dying. But we know now that was just the tip of the iceberg. Many people were infected, and we only knew about a few of them, and those were the sick people. So the actual fatality rates are lower than we thought in the general public. So it isn't changing. It's just that we understand the distribution of the virus better. Having said that, we do have a few tricks up our sleeves now. Doctors are familiar with the disease. They know how to treat it. We've got a few drugs that make a little bit of a difference. So it hasn't changed. It's the same old COVID that's killed a million people, but we are a little bit better dealing with it.
Do we know how many people, how much percentage of a population have actually had COVID? Is it 17, 20% in London? And is that different from New York? And are those people protected?
It depends on how much surveillance is going on. I mean, apparently there are countries where the herd immunity may have been reached. There's other places where it's only 20%. It really depends on the population density and how it's played out thus far. I would say that we are very far away from global herd immunity, and most places we're nowhere near it.
Jennifer, tell me your thoughts on the school dynamic. I mean, there's just so much, not so much misinformation, but different distinct threads of information that are out there. How do you perceive the debate over our elementary, our middle, and our high school attendance?
Well, there's no question that it's very safe for kids to go back to school. The chances of coronavirus killing a child is vanishingly small. But the problem we have, of course, is that kids are not hermetically sealed away from the rest of the population. Many kids are looked after by grandparents. And of course, once you get circulating in kids, it's going to spread to older populations. And we have seen that. So I think what we're looking at now is the trade-off. We cannot not educate our kids. So we have to send them back to school. And really, I think it's very difficult to prevent infection in that group. But the best we can do is just keep up with the shielding of those who are more vulnerable.
Jennifer, the press number in the United States is 200,000. We've just passed this tragic milestone of death. I haven't heard anyone really frame where this glide path is going. Is it just linear, exponential rather, and you just trend it out forward, or is there a way that it stops or it peters out?
I don't think anything's going to peter out until we have a vaccine or we have herd immunity. So you can extrapolate how many people will die based on the case fatality rate. This is a number that's known. In old people, it's a very high number. In young people, it's a very small number. As cases go up, deaths will follow. It may take a bit of a lag because if you're circulating in the younger population, it takes a while for that to trickle down to older people, but it will happen. It's inevitable. We're seeing it in many countries now, that the cases have been rising without deaths rising, but now that's starting to change. We're getting that uptick that signals that death is following. So as long as cases are going up and we have no vaccine, this is, I'm afraid, inevitable.
Jennifer, frankly, it's so confusing if you're sitting in New York or London, because there are so many different guidelines that vary, frankly, from region to region. I mean, here it's different if you live in Scotland than it is if you are in England. I mean, how should people get their information? What's safe and what's not? Of course, follow government guidelines. But as we get into the winter season, should people just be much more cautious, and even what some of the governments are saying?
I think what we're seeing is an attempt to experiment with the population. Really, we've never been in this situation before. We know how to shut down this infection, this pandemic, and that is by total lockdown. And nobody wants to go back to that. So what we've been seeing now is various governments, various cities trying to implement smaller breaks and to see which ones work. The experiment is flawed because it takes 2 or 3 weeks to work out what you've done, if that's actually done anything. So yes, you have to follow the government guidelines, but those do vary widely. And I think personally, if you're feeling vulnerable, you should take more precautions. The government has not shut down. For example, in the UK, you can stay out till 10 o'clock at the pub if you want to. Maybe you personally don't want to do that.